Okay. So I guess I got married in 2011 and I got pregnant right away. So like 4 or 6 weeks after my wedding, I found out I was pregnant. I was living in the US at the time. I was already planning to move to the UK because my husband lived here. So, but then while I was pregnant, I also had something called hyperemesis. So that's it's not morning sickness. It's basically I couldn't keep any food or drink down. I lost about 15% of my body weight.
Wow.
And I'm bigger now than I've been in any of my pregnancies.
Okay.
So I was really, really sick. So Kola had to come to the US to pack my things for me. And then I arrived in the UK in September 2011. And I went to go register with the GP. And then they registered me. I told them I was pregnant. And eventually it was the last week of November that they sent me a letter inviting me to come for a scan. I'd already had an initial scan in the US, but I was only about 8 weeks pregnant then, so they really couldn't see much. They could just see the little sac and they could see the heartbeat. And then between then and the 5th of December, I hadn't had any scans, but I had been really sick. I'd been in hospital to get IV fluids. I couldn't keep any food down. I'd lost a lot of weight.
Right.
So so on the 5th of December, that was when they finally sent me the letter to come in for my scan. At this point, I was about 20 weeks pregnant. So they sent the letter, and back then where I lived, the local NHS trust at that point wouldn't, part of their policy was not to disclose the gender of the baby.
Okay.
So they'd written that in the letter, and then they said, oh, you need to bring your money to get your scan picture. I remember reading the letter and I was like, that's their business. When I get there, they need to tell me if I'm having a boy or a girl so I can plan. Like, so I'm trying to make it sure. So I've skipped over certain parts, as in finding out I was pregnant, telling Kola. It was just like, we weren't trying to have a baby. It was a surprise. But anyway, so I got to the hospital for my appointment. I'd gotten there late because I'd gone to see a movie that afternoon. Okay. So I eventually got to the appointment, and the sonographer was like, oh, fine, they'll just squeeze me in, even though pretty much everyone had left. So the guy starts to do the scan, and, he's scanning and scanning and scanning. And he's like, oh, I can see something on the right side. And I was like, oh, yeah, I've been having some pain on my right side. And he was like, oh, no, not you. And I'm like, okay. And he keeps scanning and scanning and scanning. And then he stops, he calls somebody, and she says something to her, and she's like, okay. And then he's I'm like, oh, is there something the matter? And he goes, oh, that, it looks like your baby has congenital diaphragmatic hernia, a CDH. I was like, okay, fine, whatever. So he's like, okay.
You didn't ask, what was that?
I was like, okay, fine. I had my phone, so I already planned to Google. So I was like, okay, whatever. Like, okay. So the lady comes back and says, oh, if you could just come into this room and sit down and wait. I've got some information for you. And then she brought me a box of tissues. And I was like, wait. And then all of a sudden, the rest of the letter comes back to me, all the important parts they'd written in the letter. And I remember the letter saying that, oh, if in the course of your scan we find any issues, we'll take you to a side room and we'll have someone come and talk to you. And I was like, what's that another guy said again? Diaphragmatic hernia or CDH or something. So I whip out my phone, and the lady must have been gone 5, not even 10 minutes.
Yeah.
But in that time, I had a PhD on congenital diaphragmatic hernia. I had read everything readable. Basically, your diaphragm is a piece of muscle that separates your lungs, and your lungs from the rest of your organs that are in the lower half of your body.
Yeah.
So a diaphragmatic hernia is when you have a hole in the diaphragm. And what does that mean? If there's a hole in the diaphragm, the lungs are like balloons. Mm-hmm. So when the baby is in the womb, your baby doesn't need to be able to breathe because the mother supplies the baby with oxygen and all the nutrients and everything. Yeah. But what happens inside is that the baby inhales and exhales amniotic fluid. So that helps the lungs to practice expanding and contracting, like when you breathe in and out. Okay. But if there's a hole in the diaphragm and the organs like your liver or your intestines and your stomach that are supposed to be in the lower half move to the top, it means that the lungs can't expand and close up like they're supposed to.
Yeah.
So the lungs don't develop properly.
Right.
Which means that when the baby is born, then the baby will be unable to breathe because the lungs don't work properly.
Yeah.
So I was reading all the time. I was like, okay, the guy said it's on the right side. The right-sided ones are worse than the left. I had read everything readable. By the time the lady came back with her information, I was already bawling my eyes out. And then that day happened to be Cola's first day at a new job. So I had gone to the scan by myself saying, oh, it's going to be fine. I'm going to find out if we're having a boy or a girl. And we had been talking about whether or not he was going to be, if he was going to be a boy, if he was going to be American football or soccer. Like, those were the important conversations. Nothing, congenital diaphragmatic hernia. So the lady comes back. By this time, I'm boiling my eyes out. I didn't call Kola because I was like, oh, he's his first day at his new job. Like, I don't want to bother him. So I called my sister-in-law because she didn't live far away. And then I called Pastor Agu and I called Doc. And I was like, Doc was reassuring. I was like, oh, it's okay. It's going to be fine. I was like, that's not what they said. And I was having a full-blown meltdown. And Pastor Agu and Doc prayed with me. I calmed down a bit. The lady came back and said that all the senior consultants had gone home for the day and I needed to come back tomorrow for the doctor to confirm the diagnosis. I was like, hey, it's a whole mistake. Like, what is this? Because a congenital diaphragmatic hernia is, they don't understand why it happens. It just randomly happens.
Okay.
And it's 1 in 5,000.
Wow.
So they don't, it just, some babies just don't form properly and they wind up being a hole in the diaphragm. Yeah. But the guy had given me enough information to make me completely panic. So I went home and I was like, oh, it's going to be fine. He probably doesn't know what he's doing. The consultant tomorrow is going to say it's just been a huge mistake. So I go back to the hospital the next day for I skipped the part where, so I went back to my sister-in-law's house and then she called Kola to meet her there, that I just felt quite tired after the scan. And then Kola came and then I told him and he was so calm, but that's his personality. Like, he doesn't get freaked out. I'm the one that freaks out about everything. So he was calm and everything. And he was like, oh, do I want him to come the next day? And I was like, no, it's a mistake. Don't go back to work. Like, he's going to be fine. I'm going to get there and they're going to tell me that this whole thing is a mistake. And my sister was like, okay, she'll take me.
Okay.
So she took me back to the hospital. And the way the hospital is, like, the maternity unit is right by the front. Okay. So I said, okay, she should drop me and go and park. That by the time I get inside and she comes, like, they'll tell us it was a whole mistake. So I went inside and as soon as I got there, it was my time to see the doctor. And he wasn't a really nice guy. I mean, he no longer practices at that hospital because he had horrible bedside manner. Okay. A lot of people had complained about him because I Googled him. I Google everything. So the guy was like, oh, I should lie down. And he was like, oh, that I still kind of switch into an American accent sometimes, mixed with my Nigerian accent. I don't really have a British accent. So the guy was like, oh, that you have an interesting accent. Where are you from? I was like, oh, I've lived in the US for the last 10 years. And I recently moved to the UK. And he goes, oh, so are you even eligible for NHS? And I was like, you know what? Not today, because I have bigger issues that I'm dealing with right now. Just answer the question. What's going on? So he starts to do the scan. My sister-in-law had not even come in at this time. He starts to do the scan and he goes to the midwife. Yep, right-sided congenital diaphragmatic hernia. Refer her to UCLH. Okay, we're all done here.
Wow.
By the time my sister-in-law came in, I was back in my clothes. And she was like, oh, what happened? I was like, oh, it's done. The midwife was like, oh, do you know how to get to UCLH? I was like, I have no idea where that is. She was like, okay, well, you take the train from here. And then when you get there, you walk here. And I was like, okay. Like, I wasn't even crying at this point. At this point, I was like, okay, I need to go to this hospital and they're going to tell me what I need to do. So I was not even listening to that doctor anymore because I was just like, I don't have time to deal with this guy. Like, I'll deal with him when I have his time, but not today. So they're like, okay, they called UCLH. UCLH was like, UCLH is University College Hospital, London. So it's at Euston in London. So they called UCLH. Right away, they answered to the fetal medicine unit. So the fetal medicine unit is where they deal with pregnancies that have complications when people are pregnant with babies that have birth defects.
Right.
So the guys at UCLA said I should come in the next day. So the next morning, I think again I still told Kola not to bother coming with me. I don't remember him coming with me. I don't remember. If he had asked me to narrate this story 10 years ago, I would have given you timestamps. But so I got on the train, took the train to UCLH, figured out my way, got to the hospital. I didn't realize that train journey and I were about to become the best of friends. Like, I could tell you all the train times, when the next train was coming, when the fast train was. But I took the train there, got to UCLH, got into the room. And like I mentioned, congenital diaphragmatic hernia is 1 in 5,000. So it's possible for a doctor not to see it in their entire career. So I was very interesting. So the room was filled with a lot of doctors. So they did the scan and everything, and again they reconfirmed the diagnosis that I was pregnant. My son had at this point they told me that, oh, do you know you're having a boy? The information was no longer even relevant again. It was just like, what am I going to do with this information? It was just like, I need you to tell me that this child is going to be okay, because I'm not understanding all these things that I've been hearing and reading.
Yeah.
So they confirmed the diagnosis again, that it was a right-sided congenital diaphragmatic hernia, and that at this point I'd already read a lot about what type of hernias give better outcomes than others. Okay. So if there are no organs that have moved up, that's much better. Then they talk about the lung to the LHR ratio, if it's less than 1 or if it's higher than 1. So I'd read all these things. I was ready with my questions, and they were like,
Korede, at this time you were 20 weeks pregnant?
Right? Yes, I was still 21 weeks pregnant. So I was ready with all my questions and all the research I had done. And they were like, okay, that the liver is in the lung cavity. Okay. That's the worst case scenario, because the liver is a dense, hard thing. Yeah. It was like the small intestines or the stomach, those are also squishy, so the lungs can still push against that. Right. But the liver is hard. It's like chicken liver, like it's hard. So I was like, okay, that's the worst case scenario. It's literally everything that could be the worst case scenario. My story was just checking those boxes. So they did the scan, and the doctor was like, oh, what have you been told? I was like, oh, that I've been told this is congenital diaphragmatic hernia, 1 in 5,000, that the odds are 50%. So I was like, okay, that's fine. But that what they're going to have to do is they're going to need to run some tests, that there's a specialist at King's College Hospital in London, Professor Nicolaides, that this is his area of expertise. This is part of his specialty, that this is what he does. There's a surgery that he can do to kind of counter the effect of the diaphragmatic hernia. But that first out, they have to rule out any other birth defects that because usually I hadn't had a 12-week scan, because usually at the 12-week scan they do what is called an NT scan. So they look at the fluid at the back of the neck, and if it's quite thick, that it means that the child might have a chromosome defect, like Down syndrome, or I've forgotten the other ones. Down syndrome is compatible with life. The other ones are not compatible with life, which means that if your child has one of those birth defects, they may not even make it to term, not to even mention being born alive. So they're like, if there's any chromosomal defect, I won't be eligible for the surgery. Okay. So they were going to do an amniocentesis. That's when they stick a long needle in and take some amniotic fluid. Yeah. But before this, the first option they had actually given me was to terminate the pregnancy, because they were like... I
was going to ask that. Did they offer that?
They offered that, but I'd already ruled that one out. So that's why I didn't mention it, because that was the first option they offered me, that that even if I do make it to term, that he may not be born alive, and that even if he's born alive, that the road to recovery was going to be very long. And I immediately ruled out the termination. And I know we'll get to it later, but it's interesting. I want to mention it quickly, because I remember someone asked me after he died that then they offered me an abortion. Why didn't I take it? I could have avoided all this grief.
Oh wow.
But we'll pack that one and come back
We'll
to it.
talk about it when we talk about
We'll
what people
pack,
say. Yeah.
pack to it. I just so they said okay that they will do the amniocentesis. Initially, I didn't want to do the amniocentesis because I said doesn't that carry a risk of spontaneous abortion? And they were like, yes, and they're like, but that's the only way they can be absolutely sure. So I said, okay, I signed the consent. They did the amniotic fluid, and I said I would have to come back the next day for another scan. And they kind of gave me a high level overview of what the plan was going to be.
Okay.
So basically, the plan was going to be if everything came back fine, I would see Professor Nicolaides, I would have the procedure done, and then I would have to come back every week to UCLH for a scan every week. And that after I was going to have what they called a controlled delivery, which means I wasn't going to be allowed to go into labor. They were going to induce me so that they could have all the specialist doctors available in the hospital. Right. Because it was most of the time when babies are born generally healthy, when they are born, they cry. And what that crying does is it clears any fluids in the lung and allows the baby to take their first breath. Right. But he wasn't going to be able to do that because they were going to need to put him on a ventilator immediately. Yes. So they were going to need to have all the NICU, neonatologist, intensivist present at the hospital. And they needed to make sure they would have a bed space available for him, the ventilator, and also he was going to need to be transferred to Great Ormond Street Hospital to have his surgery. Right. So so that's why they called it a controlled delivery, because they had to make sure that they had all the steps in place. I was going to get to meet the professor at Gosh that was going to do the procedure. So I came in about 2 or 3 days later for another scan. This time the professor from Great Ormond Street was there, and there were now even more doctors to witness this. So the first scan had been the 5th of December. I had gotten married the 31st of July. Okay. So we're talking about a space of less than, we hadn't even hit 6 months yet. Wow. Wow. And so just before, this was now coming up to just before Christmas. Mm-hmm. So I'd gone back to UCLH now for the 3rd time. And so I meet the doctor who is the overall head of the fetal medicine unit, and he's like, okay, so what have you been told? And I'm again rattling off my facts like I know this like it's the back of my hand. Yeah. And he's like 50% no, lower. I'm like 45%. He's like lower. I'm like 35%. He's like lower. I'm like, you know what? Just tell me what it is. He's like, we're looking at closer to odds of about 25% of survival. Wow. If there's nothing else wrong. Wow. And I became very sober because now I'm very good at math. I'm a numbers person. I'm an accountant. So I've done these probabilities in my head. I've already been 1 in 5,000 in this congenital diaphragmatic business. Yeah. You're not telling me there's only a 25% chance he could survive. Okay. So I'm like, okay, I meet the professor from Great Ormond Street. He explains the procedure for me. They make the appointment for me with Professor Nicolaides. But they said I have to wait for the amniocentesis results first. So it was the longest Christmas of my life, just trying to still be normal. And I just moved here from the US, so I didn't have a network of friends or anything. And I felt extremely isolated. Yeah. So I remember was it Boxing Day? It was either Boxing Day or the 27th of, no, it couldn't have been Boxing Day. Boxing Day is a bank holiday. It was the 27th, so the first working day after Christmas. I get a call from UCLH. And I want to appeal to any doctors on the phone. When you are calling a patient with good news, please don't start with, I'm so sorry. Because we automatically assume you're going to tell us bad news.
Yeah, when you say I'm sorry, that's like, yeah, bad
news. Go
news.
Straight to the good news. Don't apologize for calling late. Just go straight to the good news. So the lady from UCLH calls and she's like, oh, has anyone called you? I was like, she's like, I'm so sorry. I'm like, oh my God. They're about to tell me bad. She's like, oh, I'm so sorry. Everything came back fine. I'm like, you could have started with that. Like, you know. I was like, okay, good news. There's nothing else wrong. I'm like, oh, 25%. 1 out of 4. That one is easy. I've already done 1 out of 5,000. I can do 1 out of 4. Like, let's go. So I went to see Professor Nicolaides at King's College Hospital. He's a really, really good doctor. He's amazing at what he does. But if you Google him, he has the most horrible bedside manner. Everybody that has seen him complains about him. Guy, he's not. He's not. Smartness, he's good. But bedside manner, not his forte at all. Because I was still quite confident, and I was like, oh, I'm going to go to this appointment by myself because I found my way. It was a long journey from, I used to live in Watford at the time, from Watford, because I had taken the train from Watford to Euston, and then I had looked at the train journey. I took a train from Euston to somewhere near where King's College was, and that train, that I remember that platform is really mind the gap. I felt like I was jumping over an ocean to get to the platform. Because I remember, anyway, I got onto the platform, took a bus, I found the King's College Hospital, so I got there. And because of the nature of what he does, he sees a lot of patients, and sometimes some patients take priority because of high risk. So I wound up waiting for Prof for like 5 hours, Sha.
Wow.
My appointment was 10 a.m. I saw Prof maybe like 2 or 3 p.m. in the afternoon. Sha finally saw Prof. And the reason why I'm mentioning the bedside manner is because I want to touch on the fact of how it's really important how you relate with people when they're going through this kind of trauma.
Yeah.
It's really important because so Prof eventually shows up. He actually apologizes for being late, but that, you know, the nature of his job, and he has a lot of what they call them here, student doctors, junior doctors. Well, not junior doctors, but like senior trainee doctors or whatever with him, because again, like I said, the things that he does, he's the only person he's the only person in Europe that does this surgery that was developed by him. So like if you want to learn about him, you have to train with him, and people come from all over Europe to see him.
Right.
So he walks in and he sees me. He again asks me what I've been seeing. I tell him my 25%. I'm like, yeah, I'm doing really good. So he does this scan and he goes, where's your husband? I guess he doesn't want this baby, right? And I'm just like, what kind of people do wait? So at this point, I'm like, you know what, Korede, just focus on the goal. You're here for a reason. Let's be very focused on it. So he does the scan and he's like, 25%, that's what you've been told. Well, sorry to bust your bubble. 10% at best. And that's if your child is born with absolutely nothing wrong with him.
Wow.
And I was like, okay. And it was, I can do the surgery if you want to do it. Do you want to do it? Okay, fine. Book an appointment to get you in to do the surgery. So I was booked in to do the surgery in January when I was now, I think, 24 weeks. So all of this had happened in the span of 4
weeks.
4 weeks. Yeah. So I was still very sick, struggling to eat, just making it. And I also had something called, what's it called again? I've forgotten the name now. But when you have excess amniotic fluid, so I had almost double or 3 times the amniotic fluid I was supposed to have. So that was pushing up against my lungs. So even though I was only like 23 weeks pregnant, sometimes I would be short of breath or even just struggle to walk a short distance. So he was like, oh, that when they go in to do the procedure, that they will drain some of the fluid as well.
Okay.
So I came back in January to do the procedure. And so what the procedure is, there's another birth defect in which some babies have a blocked windpipe.
Okay. And
that birth defect causes their lungs to overgrow.
Wow.
So what Prof figured was that if they can artificially block the windpipe, then they can mimic the other birth defect and try and force the lungs to overgrow, kind of fill up with liquid so they can develop properly. That's a very simplistic explanation of the procedure. Yeah. So what they do is they put a balloon about that size, about the size of a grain of rice. Yeah. And they do it while you're awake. It's a keyhole procedure. Okay. So they have 3 holes, 1 hole for the camera and 2 holes for their tools. Okay. And there was like easily 15 doctors in the room. And I'd read up on fasciculitis. A lot of women who'd had babies with congenital diaphragmatic hernias had been to see him. And I remember one lady in particular, she'd had 2 CDH babies. I was like, yes, okay. Like, this guy is not really nice, but you know what? He's amazing at what he does. She had her first CDH baby. She went in, she had the procedure. She gave birth. The baby is perfectly fine. I think her daughter at this point was like 4 years old. And then she had a son who was now like 3 years old. Same thing. I was like, okay, like, you know what? God's got this. God is the one that gives these doctors all this intelligence. So you know what? I'm going to be okay. I'm going to do this procedure and it's going to work. Right. So Professor Nicolaides did the procedure, and those big bottles of Coke that you can buy, like fizzy thing, they drained the equivalent of 2 of the amniotic fluid. That when they weighed me after, I weighed like 3 kilos or 4 kilos less. I was like, I can finally breathe. Wow. So they did the procedure, and the guy was actually, he was a bit nice, and it was much nicer this time. He used the camera to show me my baby's face and everything, and then they put the little balloon in his windpipe, and then they also gave me a wristband that I had to wear from that point on until the point at which until the point where they took out the balloon, because I then had to come back for a follow-up procedure for them to take out the balloon. And basically the reason why they started making the expectant moms wear those wristbands was, if for whatever reason I went into labor before they had a chance to take out the balloon, basically what the wristband said was to advise the medical practitioner that the baby has a balloon that they need to immediately pierce at the point at which the child is born. Otherwise, the child will be unable to breathe, and then that will lead to brain defects. Okay. Because it actually happened to one of his previous patients, unfortunately. Okay. So I had that wristband on my hand that I had to wear. So I had to then keep the balloon in for the next 6 weeks. And then they will then take out the balloon when you are at about just before, I think, 30 weeks. I don't remember the exact dates. I remember that they took out the balloon just before my birthday. So they took out the balloon in March, at the beginning of March. So, but prior to that, in February, like I mentioned earlier, I had hyperemesis, so I'd really struggled to keep any food down, and I'd been throwing up a lot. But at this point, I had now thrown up so much that, because your stomach has acid, the acid in my stomach had caused like an ulcer in my esophagus, my food pipe. So I was now throwing up blood. So I wound up in the, so I remember that morning, Kola had gone to work and I was throwing up, and I realized I was throwing up blood. So I was going to take a taxi to the hospital, but I don't think they had Ubers this was now 2012. I don't remember if they had Ubers or not, but definitely didn't have Ubers in Watford at the time. Okay. So I was like, there's no way I can walk to the hospital today. And I didn't have any local cab number. So I called one of my friends that lived locally. They used to work in the church office then. I was like, do you mind dropping me in the hospital before you go to work? So, but his wife wound up staying with me the rest of the day, which was really nice. Because she was like, I should just drop you and be going. That doesn't make sense. So they took me there. I thought they would just give me some medicine. They're like, oh, no, you're not going anywhere. Like, we're going to keep you, because they said that I had, I was severely dehydrated. So they had to, and I wasn't able to keep any food down. So, and then when I got there, they were like, okay, wait, are you in, they wanted to make sure that I wasn't in any kind of labor, because if I was, the local hospital wasn't equipped to handle me. I would have to be transferred to UCLA. So they kept me there for the next about 2 weeks or not, about 2 weeks or so. And they finally discharged me on the day I managed to have a slice of toast, because I hadn't eaten anything. I'd just been on fluids this whole time. And so they finally sent me home. And then I went, at the beginning of March, I went back to King's College Hospital to have my, to have the procedure to remove the balloon. And then at this point, they said, well, I just had to take things easy, that sometimes people go into premature labor just because of the fact that they've had to, even though it's a keyhole surgery, they've had to tamper with the pregnancy during its course, that sometimes that just can kind of cause labor to be.
Sorry, just did they have a planned date for delivery for you? Were they going to take you to full term, or did they have a planned date?
Like 37 weeks. So
Okay.
I was now, so this was now March. I was still going. So I had two doctor's appointments every week. I had my, at this point, the first doctor I had seen at Watford, I wasn't seeing him anymore because I said to them that if you insist on me seeing this guy, I'm going to sue the trust.
Yeah.
So they transferred me to another doctor, Dr. Tomi, who went on to deliver my subsequent children. And she was absolutely beautiful. So I saw her once a week in Watford. And then I went to UCLH once a week to go see the high-risk fetal maternal doctor. So the baby was being very closely monitored.
Monitored.
So I was still going for my regular appointments. And then it was now the 27th of March. And I noticed I was bleeding a bit. So I went to the local hospital, Watford. And remember, Dr. Tommy said, you can't have this baby here. That if you even happen to be in labor, you need to be at UCLA. So she immediately called the ambulance and they transferred me via ambulance straight to UCLA. And I remember I got there, they had called them that I was coming. As soon as I got there, they wheeled me straight upstairs to labor and delivery. It was like out of one of those medical shows. All the doctors had assembled. They had the infant mama. They had everything ready to go. They'd hooked me up to the machines in record time, got an IV line in everything.
Okay.
And then somebody now said, oh, she's not having contraction. She's not in labor. And boom, everything just came to a standstill. And they said, okay, well, we're going to keep you in for the next 24 hours and monitor you to see if anything happens. And if nothing happens, we're going to send you home. At this point, I hadn't packed any hospital bags or anything. And I was about 35 and a half, 35 plus 3 or 35 or so weeks at that point. Because of I didn't have a dating scar, they could only use my last menstrual period to predict exactly when I was due. So my original due date was supposed to have been like from when they did my scan in the US was supposed to have been the 19th of April.
Okay.
So that would have put me at about 35 weeks. But those early scans are not usually very accurate for dating.
Yeah.
So I was there in the hospital. They took me to the prenatal ward and they kept me overnight for 24 hours. So they said, okay, they'll send me home the next day if nothing happened. So I was just there waiting. Like, okay, we're going to send you home later today. And then I just felt like I needed to pee. And as I stood up to go and pee, my waters broke.
Wow.
But when your waters break, it's supposed to be just clear.
Yeah.
But the water was bright red. And it was, remember I mentioned earlier that I had a lot of excess amniotic fluid. I remember what it's called now. It's called polyhydramnios. Poly mean a lot, hydra meaning water, amniotic meaning amniotic fluid. So, and it just kept going and just kept going. And I pressed the buzzer bell for the midwife to come and nobody come. But they had put me in a room that was right across from the nurses' station. So I just opened the door and the water just flowed into the hallway. And then all of a sudden, everybody started rushing again. They got me back upstairs. I'm like, okay, she's not having contractions. And then they did a scan. The baby was fine. And they said, oh, the water was probably red just because of the procedures I had when I was pregnant. So probably there was just some trauma or something. But they were like, it doesn't look like an active bleed. Okay, so that's fine. I said, okay, that they'll wait 24 hours to see if I would go into labor by myself before they induce me. So I waited another 24 hours and we are now on the 28th of March. Wow, that's interesting. We're now on the 28th of March. I woke up the next morning, I was having 0 contractions and I wasn't even remotely dilated. I was like just 1 centimeter. So okay, they said they will start me on the medicine to induce me. So they took me upstairs, they hooked me up to the IV. 12 hours later, I think I was just maybe 1 or 2 centimeters. So they kept turning the medicine up, and then at this point, I now started to what they call hypercontract, because you're supposed to have contraction, pause, contraction, pause. I was just having contraction, and I didn't have an epidural at this point. I was just screaming. I was like, I'm in so much pain. The midwife came. I said, don't you dare touch me. The only thing you're allowed to touch me for, make sure that this child is okay. Other than that, please don't touch me. Then the consultant came and said, okay, you know what, they're going to stop the induction, get my body to stop contracting completely, and they're going to try again and stuff. So at this point, I was like, let's just do a cesarean and get this baby out. And they were like, no, that they can't do that because the cesarean is major operation. And I can't remember if it was the doctor or the midwife that said to me was that they wouldn't do the cesarean because they were not sure if Ademide was going to be viable. So they wouldn't put my life at risk to go undergo major surgery for a child that might not make it. And based on what I had read, they said supposedly the outcomes are better for babies with congenital diaphragmatic hernia that are born vaginally. I don't know the science behind that. But anyway, so they started the induction again, and eventually but before they did the induction, I insisted on getting an epidural. So they brought the epidural and I said, you guys need to turn this epidural on to the max. That's it. This is what contractions are. I don't want to feel pain. So once the epidural was at maximum capacity, I couldn't feel myself from waist down. I said, hey, you can turn back those drugs. So they turned back on the medicine, and I slowly started to progress at this point. And it was now the early hours of the 31st of March. That's why I was mentioning dates. I'd been on this journey from the 26th of March, when I first of all arrived in the hospital, my first 24 hours, then the waters broke, then the next 24 hours. So I've been having these contractions from the 28th of March, 29th, 30, we're now on the 31st of March. And they said, you have finally reached 10 centimeters. And I was like, thank you. Because in my mind, I was still like, I'm going to have this baby. Oh, God. We're going to go to Greater Munch Street. They're going to do the repair procedure. And I'm going to be done with all these people. We're going to be done, because that was where my mind was. Okay. So I was finally at 10 centimeters. And at this point, the epidural was working and I was very comfortable. So, I'd been talking to the doctors and everything. One doctor goes, oh, where did you go to medical school? I said, medical school. But I'm an accountant. The guy was like, he was convinced that I was a doctor, that I speak like someone that I was like, on this subject and on this child, yes. I have read so many medical journals that, yes, I speak like one of you. But don't ask me about any other condition. This one, I know it's like the back of my hand. And then they were all laughing like, oh, you should have gone to medical school. I guess part of also trying to make me feel comfortable. So Ademide was,
I'm going to ask you to. Yes.
Ademide was born in 2 pushes, and they immediately whisked him off to the ICU. But this was just the beginning of the story. Wow. This is where the rubber met the road. So Carla helped me to take a shower, because I couldn't even stand up, because that epidural, I pressed that thing to the max. I couldn't. So they said, okay, they will take me downstairs to the postnatal ward, let me to rest, and they had to go stabilize him in the ICU and everything. So when the epidural finally wore off and I was able to walk, I said, let me go upstairs and see my baby. And as I was going upstairs, I walked past one of the neonatologists that had been there to take him, the senior doctor. And I said, oh, how's my son? All 10 fingers and 10 toes, And then he looked at me, he was like, yes, but we've just noticed a few things. And, he's got a little cyst on his right eye. His ears are a bit low set. And his eyes are a bit droopy. And, I've been going through my books and the journals trying to see that he looks like he has some kind of syndrome, but we aren't quite sure what it is. Right. And this was the part that I said, my village people have finally arrived. The guy looked at me and said, I was wondering if you've come across anything in your own research. I said, you're asking me. I said, God.
Well, obviously, they thought you're a doctor now. So.
Of course, if the doctor wants to know if I have seen anything in my own research, I said, God. Okay. Now, this is the part that I don't even know whether to laugh or to cry. I said, what you are describing sounds like golden house syndrome. He said, that's exactly what I was thinking. I said, Korede, if you are praying, you thought you were praying before. this is time to take it up a notch. Because I was like, that I even knew what he was talking about. I was like, okay, wow. So I went up to see him. He looked fine. And they said to me that, okay, that they've been able to stabilize him, and that later that afternoon, the transport team from Greater Ormond Street will be coming to pick him up, and that they've got a bed space for him, that even though they were hoping for him to come in another 2 weeks,
Right.
so they've got a bed space for him, and the surgeon is going to be able to do the surgery. But that even though Greater Ormond Street is only like less than 5 minutes away, that I won't be able to go with him in the ambulance. But that when I get to the hospital, that and this is one of the things I love about Greater Ormond Street. If you have a child who is in the ICU, a baby, they provide accommodation for you and everything.
Yeah.
So I made my way to Greater Ormond Street, registered. They gave me vouchers for my meal, told me where my room was and everything. And then once I took my things, settled down, I made my way to the NICU, and I introduced myself. I met the doctors. They explained to me that they were going to be doing the repair surgery the next day, that everything looked fine. They explained to Carla and I what they were going to do for the procedure, had us sign the consent forms and everything. And they went ahead and did the surgery. The surgery actually went fine. They said the hernia was larger than they thought, but that they were able to use an artificial patch over it to repair it, and it was fine. And I was like, yes. And those, I was like, they were like, oh, that, we can do plastic surgery to do the ears and everything. I was like, that one is minor, don't worry. Actually, we were in England. They will do ears, they will do everything. And that one is a small matter. And then 2 days later, his nurse called me excitedly because I had gone to take a nap in the room, saying that, oh, he's breathing room air. Apparently, he had yanked out his breathing tube, and they decided to give him a go to see if he could breathe on his own. And she was like, oh, he's breathing on his own. I remember excitedly calling Kola that he's breathing on his own and everything. And but nobody told me at that point that as quickly as you get good news, if your child is in the NICU, it can go south in the twinkling of an eye. So I was like, okay, good, we're going to be out of here soon. They were like, oh, that, if things continue as they are, that will transfer you to your local hospital by the end of the week, and your son could be home by the end of the month. We're now in April. I was like, thank God. Now my story have changed. And I went to go try and pump some milk and take a nap. Next thing, I woke up to like 4 missed calls on my phone, and my room phone ringing. I was like, oh, what's the matter? I was like, oh, you need to come straight back to the hospital. And I walked in there, and there was probably like 15 or 16 different pumps pumping medicines into Ademide. And I was like, hello, we're back on the ventilator. What's going on? They were like, oh, that, unfortunately, that your son is septic, and right now it's touch and go. You can call your husband. You need to make a decision right now. You either need to say your goodbyes, or we need to put your son onto life support, ECMO. So you need to let us know what you would like us to do. And I said, yeah, you got like a few hours, an hour or so, to let us know if you want us to put him on life support, or if you want to get ready to say goodbye. And I was like, I'm not understanding.
What happened? What changed between?
Like, I'm talking about hours, not even days. So, the doctor takes us into the side room. Yeah, I'd already done my research. I knew what ECMO was, and, if you get to the point where you're going on ECMO, so ECMO is extra. Basically, what it means is that to give your heart and lungs an opportunity to rest, a machine pumps all the blood out of your body, puts the oxygen in, and so it's a continuous loop where they're pumping the blood out of your body, putting oxygen in, and putting it in your body. So at this point, they said that, okay, your child is now the sickest child in this hospital, and unfortunately he's so delicate that we cannot transfer him to theater to do this procedure as we would normally do. because what they do is they put two huge tubes right here into your neck where your jugular veins are. And so we've got to do it right here on the ward. So, and now this became part of my life. So when they have to do a procedure like that, and where they send all the parents out, they sterilize the place and they get to work. So they, they took the consent and everything. And guy calls up, one more thing, death is a possibility. And I was like, okay, it's okay. So we signed the papers and they put him on ECMO. And once they put him on ECMO, they now transferred him from the NICU now to the cardiac intensive care unit. And when you're on ECMO, your bed space is about 10 foot by 7. And at any given point in time, they need to have 2 senior medics in your bed space, meaning that if one of them wants to blow their nose or needs to go and they have to wait until somebody comes to replace them.
Right.
Because what they're doing is very delicate.
Yeah.
They're doing a balance of, they need to make sure your blood is thin enough with blood thinners to flow through the tubes, but not too thin that you can have a brain bleed. So every 5 minutes, they're testing the viscosity of the blood.
Okay.
So that's why they need somebody in your bed space at that time. And there's a maximum amount of time you can stay on ECMO. In Ademide's case, it was 10 days.
Okay. So how long was he there for? 10 days?
No, it wasn't 10 days old. We're now coming into the end of April. He was born on the 31st of March. So we're talking about he was like 4 to 6 weeks old at this point. So he went onto the ECMO. But before I had already gone on ECMO, they had noticed that he was quite jaundiced. He was quite yellow. They'd done all the tests. They thought that maybe he had some kind of, I was even thinking lactose intolerance. The doctor was like, no, not lactose intolerance. We're thinking probably galactosemia. I said, what's only galactosemia? He said, oh, galactosemia is like, basically, it's a kind of milk allergy where, it's a kind of milk protein allergy where, I can't remember the exact name, but basically you may not be able to eat rice, bread, like so many things. I was like, so what's he going to eat? I'm Nigerian. We eat rice. We eat jollof rice.
So wait, Korede, at this point you were pumping milk and that's what they were feeding him with.
Pump the milk. Then I said maybe it's the milk that I even giving him gone that may be making him go yellow. I said, so I'm even making my child even sicker.
Wow.
So they put him onto this special milk and they said they had to do that his liver function tests were deranged. The way medical people use their terms sometimes, what's deranged medical? But basically that just means that the liver function tests were abnormal and that he would have to see a liver specialist at King's College Hospital. So I was like, okay, but that was secondary. Sorry, that was secondary to the issue that was at hand, was that they were just trying to keep him alive.
Yeah.
So they said, okay, that they would send him that he would have to go to King's College to see the liver specialist there and everything. But so anyway, he came off because he was like bright yellow. So he came off he came off ECMO after 10 days and everything was fine. But I remember the consultant coming to find me and say, he's come off ECMO, everything is fine, he's stable. But that unfortunately, as they brought him off, they noticed that his abdomen got extremely swollen and they're just trying to investigate what was going on. Anyway, it turned out that it had to do with this issue with his liver, and his liver had become enlarged and they were trying to figure out what was going on with his liver. But he was stable and they're like, okay, he's stable for now. I've come to dislike that phrase, stable for now, because it means that your story can change at any point in time. So he was fine. He was there in the cardiac intensive unit. He came off the ECMO, went to us, and then he was on the ventilator. And then he came off the ventilator onto a machine called CPAP, which is a type of ventilator, but is a type of ventilator you can go home on. He got better, and they're like, okay, you're actually doing quite fine. That we're going to transfer you to your local hospital in Watford, and in about 2 to 3 weeks, you could have your baby home. I was like, yes. And finally, so we got transferred to Watford General, and he was there like 10 days. I remember saying to the nurse that day that his breathing seems a bit off, and she was like, oh, you're just being paranoid, eh? So I went home to go, because I live 5 minutes from, so I went home to go get some lunch, and as I don't think I'd even started eating when I got a call from the hospital, your son is in respiratory distress, and we're going to need to transfer him to another hospital. We're not equipped to handle his case. So I just threw some things into a suitcase, quickly grabbed my bag, called call. I was like, Ademide is being transferred. I don't know where they're taking him to. I got back to the hospital and they were like, oh, we're trying to find a bed space for him. Unfortunately, Great Ormond Street doesn't have any bed space. We're trying to find another ICU that has the capacity to care for babies that are that sick. So they were like, okay, we found a bed space, but you're going to be going to Cambridge, to Adam Brooks in Cambridge. So I was like, okay. They're like, yeah, the ambulance is on his way. And so the ambulance showed up. It's called, if you ever see them, they either have ants or cats on them. ANTS stands for Acute Neonatal Transport Service, and CATS stands for Children's Acute Transfer Service. So the ANTS ambulance showed up, and they're like, I can ride with them. So I got in the ambulance and made my way to Cambridge. So I got to Cambridge and he got set up in the ICU. I met the doctors there. They asked me for his history. Well, they're taking handover from the doctors, but they always ask the mom. Just so he was there, he was fine. And I remember this ENT doctor, Ian was a third doctor on the, so they were doing their ward run, and the ENT guy came and said, oh, you know, they had done what they call a bronchoscopy, where they put a tube down to see the windpipe, to see what's going on. And he was like, oh, that, you know, when they did the bronchoscopy, everything was fine. And I remember this because the registrar that was doing the doctor's round was saying to the consultants that the ENT registrar was saying, or the senior ENT guy that reported into the consultant ENT was saying that, oh, but that it seemed like there was a blockage in there. And I remember the ENT consultant coming in and saying, no, that all that's happening is that your son has a nasopharyngeal blockage, which means that from here in your nose to somewhere here, that there's a blockage there, that if they put a tube in to bypass that, your son will be home in a week. I remember I looked this guy in the face and I said to him, are you absolutely sure? Because what the doctors have said at Great Ormond Street is contrary to what you are telling me. He said, I'm absolutely sure they put in a nasopharyngeal tube. Your son will be home within 2 weeks. I said, okay. And I signed the consent form. On this blessed afternoon, when they were going to take my son off the ventilator, this ENT was off riding his bike in Cambridge. They take Ademide off the ventilator, and they put in this tube, and my son flatlines. They now, his nurse on duty that day was amazing. She used to work at Great Ormond Street, and she begins to do CPR compressions on him to try and get a rhythm back. And now, because he's been intubated, extubated so many times, his airway was already aggravated. So it takes 5 consultants to reintubate him while they are paging the ENT, who eventually shows back up in his cycling outfit with his helmet and everything. I said, where were you? That clearly you were wrong. And so, because I don't want to take this any further, you need to get on the phone to Great Ormond Street. I need to find my son a bed space within the next 24 hours. Otherwise, we're going to have major issues. You could see the color had drained from his face and he was in a panic because he realized that, because they'd already taken me to a side room to explain to me that obviously because it's taken them so long to reintubate him, they're not sure if he had suffered any brain damage, and that at this point they hadn't even intubated him back, but they had cleared all the parents out of the room because they weren't sure what was going on. They weren't getting a rhythm on the monitors, and they were trying to reintubate him, and they had paged everybody, and they'd been paging this ENT guy hadn't showed up. So they take me away to the side room and they said, okay, obviously the doctors are trying to reintubate your son and stabilize him. We don't know what's going on. And anyway, they managed to put the tube back in, and they put him on a lot of strong sedatives to make sure that he doesn't move and remove the tube or anything. And the next day, the ANTS team shows up again to transfer us back to Great Ormond Street. And I was like, okay, fine. I'm going back to the place where these people know what they're dealing with.
Yeah.
So we get there and they're like, okay, that they're going to do a bronchoscopy, that it looks like his windpipe is a bit floppy.
So how How many weeks is he now?
We are now in June.
Okay.
He's about 2.5 months old.
Okay.
So we're now in June, and they're like, okay, we're going to go down and look at his windpipe. We might be able to put a stent to hold the windpipe open. That's what it looks like, is that the windpipe is floppy, and when he's breathing, it's collapsing on itself. So if you put a stent in to hold it open, then he'll be able to breathe. I'm like, okay, we have a plan.
Already, I'm so sorry, but I'm going to ask you to just fast forward a bit because of time. We're almost doing 2 hours now. So just
Yes.
fast forward a bit, please, if you don't mind.
So anyway, they did the bronchoscopy and they came back and said, unfortunately, that he's not suitable for stenting, that the entire length of the windpipe is floppy, and that there's no way for them to secure the stent, that the only thing they're going to be able to do now is to do a tracheostomy. So a tracheostomy is when they make a hole right here, and then they put a tube right here, and you breathe through the tube in your neck.
Yeah.
So I said, okay, let's go for it. Signed yet another set of consent forms. They put in the tracheostomy, and he's doing fine. And they're like, okay, he might possibly be able to go home, but now going home, he's going to require at-home nursing and at-home care. I'm like, okay, fine, we can do that. Let's do it. The doctors from the local hospital came to visit. The local support team came. They put out the adverts trying to find suitable care workers that would come to the house to help us. They came to do a home evaluation. At this point, they said, you need to speak to a psychiatrist. I don't need to speak to a psychiatrist. I don't need a psychiatrist. Because basically what they said was that I was not behaving like someone that was rational, that I keep talking about this, my faith, that my son is going to be okay. And they needed to let me know that it's possible that he may not be okay. He may not be okay, that I didn't appear to be quite rational.
Yeah.
So anyway, I sit down with the shrink lady. She makes her notes, whatever. She's like, I'm okay. I just seem to have my deep, strong faith. And they come to do the home assessment. The house is fine. Everything is fine. And we're like, where go? And he's doing fine. All of a sudden, he goes into respiratory distress again. He's back on the ventilator again. And the doctor's like, okay, we're going to restart all our investigations again. So at this point, he'd come off ECMO, and there's a lot of potential side effects with ECMO and the medications that he had been on and everything. So they started everything again, and they came back and said, well, that it appears that he cannot see, and that it's possible that he is blind because he's not responding in the way they expect him to respond.
Wow.
And then they did his hearing test again, newborn hearing test, which he had passed, and everything was fine. And they said, well, it appears that your son has bilateral deafness. He can't hear in either ear. I was like, okay, that's fine. What are we doing to... And then I can never forget the day in June. The cardiologist came to me and he said to me that Ade's mom, it's not a matter of if Ade is going to die, it's when. You need to make a plan for how you want your child to die. And you need to speak to palliative care. And I was like, I'm not speaking to palliative care. You need to tell me. And I said, I'm not speaking to palliative care. You need to explain to me what we need to do next. And he was like, there's a problem with your son's heart. I'm like, what do you mean there's a problem with my son's heart? We are now in month 4.
Yeah.
That, how did you miss this? And he was like, oh, that he has what is called a partial anomalous pulmonary venous drainage. What does that mean? It means that his heart wasn't connected properly and the oxygenated blood was mixing with the deoxygenated blood. I was like, okay, fine. Where are the consent forms for the next procedure?
Yeah.
And he said, it's inoperable.
Wow.
That's too small for us to do the surgery. And even if we did the surgery, it is very, very unlikely that he would survive. That the combination of defects that Ade has is unlike any we have ever seen before. And that there's nothing that we can do to improve the quantity or the quality of his life. That's so you need to make a plan. How do you want your child to die?
Wow. Wow.
And was insistent that I was not speaking to the lady from palliative care. I was like, I'm not doing that. I'm not doing that. But one day on the ward round, the lady shows up and she's like, oh, hi, my name is blah, 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 and I'm part of the palliative care team. And I'm here to speak to you about your options. And I was like, you can say whatever you want to say, that's you. And I remember we haven't been married for a year at this point.
Yeah, not up to a year. Yeah.
No, we're not a year yet. So I was like, I'm not having this conversation. And I remember, sorry, I'm going as fast as I can. One of my really good friends who had been an amazing support system for me, it was now coming up to her baby shower weekend. And I was like, okay, I'm just going to go. I'm going to just go and be there for her. And I went. I remember one of my really good friends, like my cousin, she was like, oh, what baby wash are you using for your baby? Because, African skin gets really dry. In my mind, I was like, I wish those were the kind of problems I was dealing with. But I answered her and I told her what I was doing. And then there was another girl there who had given birth in a taxi. And the room was filled with so much joy and so many happy people with their babies. I just said to my sister, these people are too happy. We need to go.
Oh, wow.
Nothing against them, but
I know.
their joy was much. And there were too many happy mothers and babies. And I was like, no, this is not working. So I remember I went back to the hospital. And apparently something had happened with one of his IV lines and he had yanked it out. But because he was 4 months old, it was almost 4 months old at this point, and he only weighed 4 kilos. Just to give you perspective, the newborn babies that are born at 4 kilos or 3.8. And so because they couldn't find any vein, they had shaved off part of his hair and put an IV line in his head. And I just saw red and I just screamed. And I said, I thought you guys said you had no extreme measures. This is an extreme measure. They're like, you need to calm down. I'm like, I'm not calming down. Why does my child have an IV in his head? Anyway, I eventually calmed down and Carla says we should go away for the anniversary weekend. He books a lovely hotel in Berkshire. I'm like, I'm going to come because everybody says this is a good idea, but I'm not really there. I'm there, but I'm not there. I spent the entire weekend calling the hospital on the hour. What are his stats now? What is this now? And as soon as the whole anniversary weekend was over, I said, please, can you just drop me at the station? I need to start going back to Great Ormond Street. And I headed straight back to the hospital. And not the next day, a week later, we're now on the 6th of August. The doctor said that they were going to have MDT meeting, a multidisciplinary team meeting to discuss Ademide, and they would like myself and my husband and any other family to attend.
Okay.
So we all trooped into the hospital, into the cardiac intensive care unit at Great Ormond Street. And they took us through everything they had done from the day he was born up until that point.
Yeah.
And basically reiterated what they had said to me was that there was nothing more that they knew that they could do to him that could improve the quality or the quantity of his life.
Okay.
That keeping him on the ventilator was only prolonging the inevitable. And that their recommendation was the palliative care, and that they would support me in however way that I wanted to choose for him to die. If I wanted to remain at the hospital, if I wanted to go to a children's hospice, or if I wanted to transfer him home and have support there. And I said to them that I would prefer to stay at Great Ormond Street Hospital, that it was the place that I felt safest and most comfortable, and that I would choose to stay there.
Okay.
And that I was also I understand what they're saying, and I agree with the decisions behind why they're saying what they're saying, because now at this point the heart wasn't connected properly. He couldn't see, he couldn't hear, his lungs weren't working properly, his his liver function was not working properly, and they had never seen a child with that combination of issues. So we made the decision to take him off the ventilator on the 6th of August. And they said they were not sure how long he would be after we took him off the ventilator. But they took him off the ventilator in the evening on the day of the on the 6th of August, and he died at 6 o'clock the next morning, about 12 hours later, on the 7th of August, exactly a week after our 1 year anniversary.
So sorry about this.
Yeah.
Well, I was thinking, when you were talking, I was thinking that with everything that he went through, he seemed like a fighter. Because and you also were there fighting for him too.
Yeah, I came to realize that even though I was going through my own trauma and my own issues,
Yeah.
what I came to learn about the NHS was that you have to advocate,
Yeah.
and you have to fight for your child.
Yeah. Yeah.
And so I had to be in that place where I needed to make sure that they were doing all they knew how to do.
Yeah. Yeah.
How they knew how to do it.
Yeah. Yeah.
And I had to be that person. Obviously, I didn't get to speak about my subsequent pregnancies where I also had interesting issues. That's why I mentioned that UCLH and I became really good, became really good friends. But throughout the entire thing, I know I didn't talk much about praying. And yes, I was praying. There was a lot of why me, God. Like, I just didn't understand why. I wasn't even trying to get pregnant. So why would God allow me to get pregnant and then take this child away from me? And where was God when my child died? And something that God said to me, and I can't remember how long afterwards. I still have this Joyce Meyer CD that I used to listen to when I was in the US, and there's a part in the CD where she's sharing a story about a pastor whose son was building a stage, a platform that he was going to minister on.
Yeah.
And while the boy was helping to build it, the thing collapsed and crushed the boy, and the boy died. And anyway, they finished building the stage eventually, and a few weeks later, this pastor was back on the stage preaching, but he was now speaking to Joyce and saying how he had been so angry for a long time, and that he kept saying to God, where were you when my son died? And I bear in mind that I've listened to this CD 20, 30 times, but this part of the CD had never really registered in my mind. And the guy said to Joyce that God said to him, when he asked God, where were you when my son died? And God said to him, exactly where I was when mine died.
Yeah.
And when I listened to that CD again, I was like, for the first time, I heard those words. I was like, okay, one thing I'm very, very, very aware of is that nothing catches God unawares.
No.
Nothing catches him by surprise. I can't tell you today that I know the why my son died. I don't know the why.
And you probably never know till you get to heaven.
I know that nothing catches God unawares.
No.
And that God is not evil. God doesn't do evil things. God doesn't go around killing people. But God allows things to happen why we don't know. That's why when the devil went to God and said, let me deal with Job, and God said, he's not going to deny me, go and do your worst. God allows it to happen. I don't know why, but he allows it to happen. But it took me a long time to get to that place.
Yes.
And I still think about it and wonder why, but I always say I choose to park myself in the camp that God understands why he allowed it to happen.
Yeah.
And that's where I'm going to stay.
Yeah.
Because if I remove myself from there,
it's going to,
then it means that you mean anything can just happen to me at any time? See, like, no. I need to park myself in that place where God allowed it to happen. I don't know why he allowed it to happen, but God's plans for me are for good and not of evil, to give me a future and a hope. So I'm going to park myself there in that God's plans for me are for good.
Korede and Abby, seriously, thank you, ladies, for sharing your stories. And you're very brave, the two of you, very, very brave women, very strong women. And we really do appreciate you guys. We've done 2 hours, but can we just take, even if it's 5 minutes or so, to share about, when we're having a pre-session thing, you guys talked about the things people say or things people said to you whilst you guys were going through and even afterwards. Can we talk about that just quickly, please? Because I think it's so important. One of the things, when I was thinking about it, I was thinking, is it ignorance? Is it that people they're just not self-aware of the things that they say? Do they just, I don't know. Can you just share some of the things? I mean, there was something you said to us when we're talking, Korede, that I thought, I can't believe someone actually said this about the school fees. Can you talk about that?
So I remember after Ademide died, someone thought that the most helpful thing they could say in trying to, as Nigerians would say, ginger me and, give me something to take my mind off it, is to say that, at least be grateful you are not started paying school fees.
Can you imagine?
I remember my response in that moment. It was not a very Christian response. And I said something to the effect that perhaps one of your own children, so you can receive your school fees bill, since that is the matter at hand. And, everybody got upset with me when I responded in that fashion that, oh, Korede, you're being rude. That's not a nice thing to say. And I said, what she said, was it a nice thing? Oh, that's not how she meant it. Da, 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 da. And what I want to say to people is that we need to have a certain level of self-awareness. I was saying yesterday when we spoke was that there's a Yoruba adage that says it's not everything that you see
that you say
that you must say or comment on. Some things you just let it go. You are thinking it sounds fantastic up here. You don't necessarily need to say it. There's a lot of trauma that is going on. Or when you ask women, did you use one kind of medicine? It's because you're focused on your career. There's no woman that has lost a child that does not already blame herself.
Absolutely.
Not already gone through a self-assessment to say, it's because I did this, it's because I did that. If only I had done this. She's already blaming herself. She's already carrying a lot of trauma and a lot of pain. Just be there, just sit down, bring her food. She may not want to eat. I mean, one of my friends, I always say to her, Enime, she was the absolute best support ever. She would just come and sit down with me. We will sit down on the sofa, we'll nap together, we'll wake up, we'll eat, she'll get on the train and she'll go back home. And that was it. But that was just all I wanted. And when I wanted to vent, she would listen to me. And then when she needed to say something to me, she said something to me. She said to me that, Korede, because I was reading a lot of stuff, and I said, Korede, I know you're in a lot of pain now, but you cannot forever dwell in this place of pain because it will eat away at you. So, and I believe that when people say, or people say to you, the Bible says, don't mourn like those that don't mourn like those that have no hope. The Bible doesn't say do not mourn. It's when my interpretation of that is when you sit in that place of grief and you let it completely eat away at you. That's my understanding of what the Bible means by don't mourn that those who have no hope. So allow people to mourn.
Let me bring
enjoy them.
Yeah.
Just sit down there and just let them know that you are there for them. You don't, this is not the time for us to know that you know your Bible. This is not the time for us to be quoting scripture. Because we too, we know the scriptures. We have searched the scriptures to find the answers. We know the scriptures about it is well. No, we know it. We can quote the Bible back at you. All we want is just for you to sit with us and just allow us to be in that place of grief, because we have to process that grief. We have to process that trauma.
Abby, what's been your own experience?
Um, I feel like mine is a little bit different because not a lot of people were aware of what I had been through. So it was more of, why is it taking you so long? And you know, are you guys still doing honeymoon? I was thinking, this is now what, 4 years later, and we're still 3, 4 years later, we're still doing honeymoon. Like, it was just the like insensitive comments. I just feel like sometimes when you don't understand something, you don't have to actually say anything. Sometimes I feel like people just have to say something, and what they need to realize is you don't. But then, yeah, and I do like to be a little bit more positive and say maybe people don't know, but I think a lot of times common sense should guide people. Like, if a couple have not outwardly told you, do you know what, we don't want any kids, we're good, just the two of us, just be guaranteed that they do want a child, but maybe it's taking them a little bit longer. It's not because they're not having sex like the rest of the world. It's not because they are enjoying a time out. If you don't know what, I always say this, and maybe it's because of what I've been through. If you don't know what to do with someone, just pray for them. And you know what else? We don't even need to know that you're praying for us, because sometimes that in itself is like, oh, do you know what? I'm praying for you. God will do it for you. Do you know what? I'm praying for myself. And do you know, that's nice sometimes, but to hear it all the time, it can be a bit much. Pray for me, but do it in silence. And you know what? When that testimony comes, you can say, do you know what? You might not know this, but I've been praying for you. And you know what that would do for me as a person? Just to know that somebody has taken it to God in their private room is way more than you telling me that you're praying for me, you know? So do you know what? Those are the things. I remember one time going to a service and they were doing testimonies, and you think, do you know what? You're in church, you should be happy and really excited. This lady went on stage and she was talking about her testimony of her second child. I had to walk out of the service, not because I wasn't happy for her, but I was so sad for myself and I felt bad for not feeling happy. I was just more engrossed about the pain that I was feeling. I was like, God, look what you're doing for other people. And like, it was just such a hard place to be. But do you know what? Every day, one day at a time. So what I wanted to say for people who have been through what we have been through, both our stories are completely different, but both are underlined in a place of trauma and, you know, hurt that, you know what, no one can even talk about. You can't even question it. You can't even put it into real words. You just find a way to find peace and happiness in any way that you can, you know. I mentioned earlier, for me, worship songs did so much for me. Like, just hear words I couldn't actually pray, because sometimes I couldn't pray. But if I was hearing a song and I was hearing those words, it was like it was ministering to me in ways that my prayer wouldn't have been able to, you know? And so things like that, doing, you know, going into like groups, support groups. I'm part of so many groups right now that it's a lot, like loads. But you know what? If I can help one person not feel like I did, where I felt like nobody understood what I had been through, it's just everything. Just having someone who understands where you are, right where it's just something completely, you just can't put money on it. So just, yeah,
And I
just
think
try and find the
also
people that
one
you
of the
want.
reasons why you decided to do this was also for people to know that they're not alone. You know, there are loads of
Absolutely.
people, loads of women who have been through, going through, and some, I'm not saying it as a curse, but some people will go through this later on. But you are not alone, and there's hope, because these two women, Korede didn't mention this, but she now has two beautiful daughters. Abby has a son, so there's hope for you, whatever it is that you're going through. Don't give up. Just keep trusting God, and He'll come through for you eventually, whatever it is. And even if not pregnancy or child loss, you know, God will come through for you. But we have to keep holding on to that hope. And part of what Abby is doing is she has. Tell us a little bit about what you do,
Okay, so what I was talking about, my little creative side, I just felt like, do you know what? People don't talk about it enough, or like they don't, there's not necessarily a space for people to sort of like just, I don't know, to just be, I can't really put it into words, but it was more, I wanted something that people could celebrate all forms of like the pathway to motherhood, be it somebody that's taken a little bit longer, be it someone that's secondary infertility is something that people just do not talk about. Like it's people are like, oh, you should be happy you've got the one. But what if my dream was to have four? I'm still mourning that desire. So people don't even talk about that. A lot of it's based on fertility and having that child. But what about what all your other dreams? And so I wanted something that could encourage people and also just to recognize that people aren't alone on their journey.
Let me stop. You know that thing that you said? I think a lot of us, we don't realize that saying that is so insensitive. At least you've got the one, you know.
Absolutely.
It's just like somebody who wants a
Absolutely.
promotion at work. You said at least you have a job. So don't even bother.
Yeah.
Stay there, pack it there. It's so insensitive.
And then it makes you feel like you're ungrateful for the one that you have, but really that you're not ungrateful, because your dream was not to just have that one. Your dream was to have a little bit more than that. And so you're very valid to mourn that the same way as someone who's mourning one. There's no, in my eyes, there is no real necessary difference. Others might disagree, but I feel like if you've had a dream, that is your dream, and that's up to you to have that dream. No one should be able to take that away from you. And so, yeah, back to what I was saying. If you look on my page, I won't go too much into it. It's called Form Clothing, which means fearfully and wonderfully made. So I believe that every child is fearfully and wonderfully made, no matter what journey, what process it's taken for them to get there, whether it's IVF, donor, however, surrogate, whatever it is to celebrate all forms of your journey to pregnancy, and for even those who are still on their journey to pregnancy. So let me show it to you. I did have them out. Little baby grows, almost like faith gifts, so that you have something. So this one says prayed for. So one day your baby will wear this. You've been praying. One day you've got that faith that, my baby's going to wear this. And then I have another one that says hopeful or hope. So a lot of people have, just embraced it. And even for us, like to wear a t-shirt that says hope. I've got t-shirts that says hope, just to encourage us, because sometimes you can feel so alone in this space that it can feel a little bit deafening, and it feels like even the people around you. And I wanted to touch on this. It can be the people in your house. It can be your closest family. They may not get it because they haven't necessarily been through it. So it's hard, so sometimes it feels a bit like you want to express yourself, but it feels like, oh, she's talking again. Like you need to kind of move forward, but sometimes you don't want to move. Not that you don't want to move forward, but you just want to be. Just like Korede says, you just want to be. Allow people to be, and I think that will be the best way to go forward. So it's just about, for me, it's holding on to hope. Hope. It doesn't matter how little that hope is. Yeah, as long as you've got it. God says you need the faith of a mustard seed. Mustard seeds are tiny. That's all it takes for you to be able to just say, do you know what? Everything else in front of me is a huge giant. But if I've got that small faith, the small faith I had, I believe is what gave me is what allowed me to go through my journey with Josiah. Because that I had a tiny faith, but it was still there guiding me through. And it will do the same for every single person listening. Whether you are on your journey, you have been through certain things that we've been through, God is still on the throne, and he's still in the business of doing miracles. He hasn't stopped, and he won't stop now. He's not going to stop at us. And I always say to people, if God can do it for me, there is no difference between me and the next person. He can do it for anybody. Like there is nothing that is special necessarily, that if he's done it for me, that he can't do it for somebody else. So just hold on to that. Hold on to it. That's my word.
Thank you so much. Korede, are you still fundraising for Great Ormond Street?
I don't have a current one right now, but I do still fundraise for Great Ormond Street. I can share the link with you after this.
Okay. So that if people want to sub, because they're actually doing a fantastic work at Great.
Yeah, they provide amazing support for the parents, and the doctors there are just amazing. You meet a lot of doctors that are not so nice and not so caring, but the doctors and the nurses that are there, they're there because they genuinely want to be there. My second daughter had to go to Great Ormond Street for a procedure when she was about 3 years old. And one of Ademide's nurses came to find us and brought her some snacks. And this is like 4 years later. No, it's like 5 or 6 years later, actually. And, they're just they're an amazing team of people. I mean, they used to make all kinds of posters and signs for Ademide. Like, it was just, I remember one time when one of his toys, the battery had run out, and we're talking about 10 p.m. at night. And the nurse went to go find someone in their engineering department to find batteries at 10 p.m. to put into the toy and everything. Like, they're just such lovely people. And a lot of the support they offer to the parents is funded by donations and not what the NHS can pay for.
Yeah.
So like when Ademide was there, I had meal vouchers every day, and I had an ensuite room that was mine to stay in, and they provide all of that free as part of the Great Ormond Street charity.
Shout out to Great Ormond Street. No, I know they're doing, because I know Dr. Zion is on to, and she too. She has her own story, which we'll talk about some other time. So
shout out to her well, because she really helped me through my trauma. I remember sitting down with her and talking to her, and she really brought me out of a really dark place. So thank you, Dr. Zoe.
Well done, Dr. Zoe. And again, I mean, there might be people who need to see a therapist. Dr. Zion is there. And the other therapist, Christian therapist that I can refer you to, just slide into my DM and let Hangout Cafe DM, and we'll refer you to someone. If you want to talk to Abby or Korede, further ones, follow them, slide into their DM. And I'm sure you guys will mind speaking to anyone who's going through.
No. But, sorry, just to touch on that, therapy, I'm really, really glad I went to therapy. I needed it. And I would advise anyone that is going through that, talk to someone. I know it's not something that is really common in our culture or among Nigerians.
Yeah.
But therapy is the only reason why I can be talking to you guys today.
And you know, especially Christians, we have this thing about, oh, but I'm trusting God. Because you're trusting God doesn't mean that you can't seek help or talk to someone. You know?
Absolutely.
And especially if the person is a Christian therapist, they will help you, because even when they're ministering to you or when they're speaking to you, they can also direct you to the Word of God. So please seek help. Don't go through anything alone. And there's no shame in it. Nothing. In fact, when I was talking to Abby and Korede, I said, and I'm sure you guys hear me say this a lot, I don't understand why we attach shame to these things, you know, be it pregnancy loss, miscarriages, abuse, you know, it's just like, and you remember we said that, is it just the African culture? Or, and we've all said, no, it's not just African, that the Asians and some other cultures have the same thing, where there's a stigma attached to all of these things. So please speak to someone, find someone that you can speak to. It's so important. But whatever you do, don't go through things alone. Okay? So thank you.
Auntie, I just wanted to also add really quickly is that, you know, I think a lot of the time also when it comes to pregnancy loss, because of how early it is, or, you know, people think, oh, if it was just 6 weeks, or it was just this, you know, it's not that important. But I like to always say, the moment you get that positive pregnancy test, you have almost planned that child's wedding. You've literally already planned how you want to pan out that child. Obviously, you're not in control of that child's life, but you have almost gone through the motion. So whether it is 4 weeks, 12 weeks, 20 weeks, every single grief is valid. So don't think that you have to sort of be like, oh, it's not even, you heard that one, oh, it wasn't really a full baby anyway. But in my eyes, it was a full child that was going to school. You know, it's a huge loss of my dreams. Please don't take that away, you know. So just to encourage every single person, just feel whatever it is that you need to feel and allow yourself to feel it. Don't ever let anyone feel that it isn't that way. That's what I wanted to pretty much end on.
Thank you.
But we have hope, and God is hope.
That's it. You guys with a prayer, but I want to appreciate you guys again, ladies rather, Korede, Abby, amazing, very, very brave ladies. And I pray that God will continue to strengthen you and God will use
Amen.
you to impact the lives of other people who are going through or who have been through or people who may go through. Because, you know, like I said at the beginning, I think the statistics is that it affects the 1 in 4.
1 in 4 for loss,
1 in 4
What?
and 1 in 8 for
and
infertility.
1 in 8 for infertility. So a lot of women may have to go through this, but with people like you sharing, talking about it, will be able to encourage others and show them that there is hope. So my prayer for everyone and anyone going through anything is taken from one of my favorite scriptures, Romans 15:13. And I pray that God, the source of all hope, will infuse your lives with an abundance of joy and peace in the midst of your faith, so that your hope will overflow through the power of the Holy Spirit.
Amen.
Amen. Amen. God bless you, everyone. Thank you so much for joining. Thank you for those who have stayed with us. I know it's been almost 2.5 hours. It's been long.
We said it, Auntie. We said it. We said it's going to be long.
Thank
And
you.
I didn't even get into the details or even like
You know, you
talk
didn't. No.
like, you know, I didn't
But
know past pregnancies.
but I think I personally think it's been worth it, and I'm sure the ladies too will say the same thing. It's actually been enlightening. The things people go through that you don't even know. You just see people walking on the street and you think, oh, you know, they're fine, but you don't know the challenges that they're going through. And people are going through a lot, a lot. And Korede, when you were talking, I was thinking, my goodness, how did she remember all these things? You know, but because you've been through, you were in that space. So I guess you didn't have a choice but to, you know, try and remember. Even Abby, remembering all the things, I'm like, I don't even know what they're talking about. And I'm a doctor's wife. I don't even know anything about what you guys are talking about. But yeah. So thank you, ladies. Love you so much. Love you
Thank
so much.
you. Thank you, Auntie. Thank you. God
Bye.
bless everybody. Enjoy your weekend.
And you
Bye.
too. Take care. Bye bye.